Hello everyone. So NEET PG is just around the corner. Only 2 to 3 days are left for the NEET PG. This is the moment which you all have been waiting for, or maybe not. I know बहुत ज़्यादा anxious होंगे, बहुत ज़्यादा anxiety हो रही होगी, nervousness हो रहा होगा. You don't feel like studying. I have gone through the same phase, but just believe me, 3 days only, and उसके बाद party. ठीक है, that is how I motivate myself whenever I am preparing for any exams. So currently my fellowship exams are going on for intervention radiology fellowship, and I also say the same thing to myself कि बस 3 दिन और पढ़ना है, उसके बाद I am free. ठीक है, so just study for these 3 days. 10 to 12 hours of study now for the next 3 days. Doesn't matter what you study now, बस पढ़ना है. ठीक है, बस पढ़ना है so that we are in the habit of studying and we don't feel guilty. ठीक है, so in this video I'll tell you how to solve an MCQ for your NEET PG, because MCQ solving skills is a whole together different ball game. you know Out of the 200 questions that will come in the NEET PG, you will be knowing the answers, sure short answers of only 100 questions. For the rest 100 questions, you have to make intelligent guesses. ठीक है, and there is no shame in guessing an answer, because the topper will also be guessing an answer, and even you who thinks that you are an average student, you will also be guessing an answer. So guessing an answer is an art. Here to me in this video how to do that. Okay, so first of all, remember that NEET PG, INI-CT, FMG, for that matter, any MCQ exam is not a game of ruling in, but it is in fact a game of ruling out options. You have to rule out options. That is the main purpose of any MCQ exam. Okay, so even for example, you know the answer to a particular question, you have to ask yourself, are the rest of the options ruled out? This answer has always to be asked. This question is always to be asked, and the answer should always be there with you. That are the rest of the options ruled out? Okay, I'll give you few examples. For example, this was the question that came in this year's INI-CT. Okay, this is not a previous year question, by the way. This was a new question, and it was asking about ultrasound contrast agents. And it had asked which of the following IV contrast can be given in CKD patients. Okay, the options may be different. Yes, I've modified it a little bit. So the options are iohexol, gadolinium, gastrografin, and sonoview. Okay, maybe you have heard about the first three, you have not heard about the fourth. And you know that in CKD patients, we cannot give iodinated contrast that we use in CT scan, nor can we give gadolinium because both of them are nephrotoxic. So we know that iohexol and gastrografin are iodinated contrast, so we cannot give them. They are excreted via kidneys. So kidneys kharab hai CKD patients, their toxicity will rise. Similarly, gadolinium we cannot give. So by exclusion, the answer becomes sonoview, and I think the option that was given in the exam was ultrasound contrast agent. Okay, that was the answer. So even if you don't know what sonoview is, you have to rule out the other options and still get to the answer. And by this ruling out option, I'm sure you will be able to correct around 40 to 50 questions. Okay, this is the most important thing, ruling out options in your NEET PG exam, and this will eventually decide your rank. So how much to attempt? So I'm writing it here only. How much questions to attempt? So for a NEET PG exam in which your negative marking is 1/4, 1/4 is a very liberal negative marking. You have to attempt more than 190. Because even if you get 3 questions wrong and just one question correct while guessing, you will still get 0.25. Okay, because it is +1 -4, -1/4. So you have to attempt high, at least more than 190 question. And as a dictum, if you are able to rule out one option, you have to attempt it. Okay, you have to attempt the question. This is a rule. Okay, ruling just one option is enough. You have to attempt that question. Now, another type of question which a lot of students, mistakenly get wrong is not true, except, false, unlikely, such kind of questions. These questions you cannot get wrong. So Jabibi, you read a question, an adult man came to the OPD with 1 month history of fever, shortness of breath and falling BP. Okay, he's hypotensive. X-ray is shown below, which is the incorrect statement. So whenever you are reading these buzzwords incorrect, what I do is just encircle them so that it sticks in your memory that I have to mark the false statement. So this X-ray is showing pericardial effusion. Okay, the patient's BP is falling. So we are dealing with a pericardial tamponade, right? Pericardial tamponade. And the examiner is asking us incorrect option. Now we know that pulsus paradoxus is seen in pericardial tamponade, yes, and some of you maybe might read it as a correct in the question and mark as one. But read read all the options as well, and encircle this incorrect thing. So it shows pulsus paradoxus, it is a correct statement. The management is emergent pericardiocentesis. Yes, the patient's BP is falling, we need to drain the fluid, so this option is also correct. Loud S1. Now, in pericardial effusion, pericardial tamponade, we get muffling of heart sounds. So this is an incorrect option. And electrical alterance is seen. Yes, electrical alterance is seen. So the correct answer here is option C. This is the incorrect statement. So don't, get these questions wrong. Ki, acha correct pucha tha, incorrect pucha tha. You cannot get these type of questions wrong. Okay? Now, sometimes the best correct answer is asked in the question. The best correct answer. Okay? Maybe all the 4 options are correct, but still you have to choose the best correct answer. This is also a type of MCQ that is asked. For example, this question, which of the following is true regarding findings of tuberculosis on chest X-ray? Okay? Bilateral hilar lymphadenopathy can be seen. Yes, it can be seen, but most commonly is unilateral hilar lymphadenopathy that we see in TB. Bilateral is more common in sarcoidosis, but yes, bilateral can be seen in TB. Now, unilateral upper lobe cavitation, is this seen in TB? Yes, it is one of the very common findings in TB on chest X-ray. Now, solid lung mass, solitary lung mass is a less common finding. Yes, it is a rare finding, but it is less common. Solitary perihilar consolidation or perihilar consolidation we characteristically see in pneumocystis cerevisiae pneumonia, PCP pneumonia, right? So the best correct answer here is unilateral upper lobe cavitation. Okay? So this is also a type of question that you guys can get wrong. Now, sometimes, you might not know the question at all. This might not be taught to you, or this is not a previous year question. You not read that topic. For example, in 2018, July 2018, when I was giving the exam, this question on SMA syndrome came. Okay? And now it is a previous year question, but for us, it was not. It was a new question. So how do you attempt such kind of questions? So first of all, read all the options. You might get a hint in just reading all the options. And remember, few of the questions are such that the examiner gives contradictory statements within that same question as an option. And remember, what I have seen that such contradictory statements, when given in a question, the answer is between those two options only. So for example, in this question, let's read the options. SMA syndrome, the other name is nutcracker syndrome. I don't know. It's more common in males than females. I don't know. The aortomesenteric angle and aortomesenteric distance are 28 to 65 degrees and 10 to 34 mm respectively. I don't know what that means. The aortomesenteric angle and aortomesenteric distance is reduced to less than 25 degree and less than 10 mm respectively. So both of these statements are talking about the same thing, and it is sort of contradictory. So the answer most of the times lie in these two options. Since you have ruled in two options now, you have ruled out the other two options, you have to attempt this question, and in this case the answer is D. So I'm telling you that such questions you have to attempt even if you haven't read the topic. Now, still saying that you have to attempt, but still I would say that you are free to leave few questions. Okay, I'm saying attempt more than 190 questions. You can still leave 10 questions, and intelligent guesses. If you know 100 questions, you can make intelligent guesses in about 80 to 90 questions, I'm sure, if you have read well and if you are able to रूल आउट ऑप्शंस. ठीक है, कभी भी एंग्जाइटी में नहीं आना कि आई डोंट नो द आंसर टू दिस क्वेश्चन. ठीक है, बहुत सारे क्वेश्चंस होंगे जिनके आपको एग्जैक्ट आंसर्स नहीं पता होंगे. यू विल नॉट नो द एग्जैक्ट आंसर्स, बट इट इज अ गेम ऑफ रूलिंग आउट ऑप्शंस. दैट इज ऑल. ठीक है, एंड फाइनली आई वुड लाइक टू से दैट trust your preparation. You have studied for this exam for the past 1 year, for the past 2 years, whatever may be the case, and now is only the time to just keep on working hard. ठीक है, हिंदी में कहते हैं कि कर्म करे जा फल की चिंता मत कर। एंड एग्जाम टाइमिंग में ये definitely valid है, you don't know what kind of questions will be asked, you don't know whether you will be able to answer all the questions correctly, but just trust your instincts, believe me कि जो बैक ऑफ द मेमोरी में सबकॉन्शियसली आपने पढ़ा होता है एमबीबीएस में, पीजी प्रिपरेशन में, कोचिंग क्लासेस में, इट स्ट्राइक्स, इट स्ट्राइक्स। एंड आई वुड स्टिल से वन थिंग, that go with your gut feeling. Gut feeling people underestimate a lot, but gut feeling काम कर जाता है, ठीक है। सो लास्ट फाइनली आई वुड से दैट अ बर्ड सिटिंग ऑन अ ट्री इज नेवर अफ्रेड ऑफ द ब्रांच ब्रेकिंग। उसको नहीं पता कि वो, सिमिलरली यू डोंट नो वेदर यू विल पास और यू विल फेल, बट बिकॉज हर ट्रस्ट इज नॉट इन द ब्रांच but in her own wings. Similarly, you have to trust your preparation, you have to trust what your teachers have taught you, what you have read during your MBBS. ठीक है, this is an exam, this is just a phase, this will pass, pass and you will join a residency soon. ठीक है, so all the best to all the PG aspirants who are appearing in this NEET PG. My best wishes to all of you, and I'll see you on 23rd when we do the recall session. Thank you so much and all the very best.